morning, everybody. This is Dr. Smith, and I'm here to talk to you today about abdominal breathing. Breathing, as you know, is so important. We can't do it for very long and stay alive. But for most of us, we've actually started to breathe in an improper way that actually can cause more disease down the road. In fact, this is probably the main thing that I teach the majority of my patients. I have to start with this breathing because it's so important. What I found is that most of us are breathing very shallowly, breathing up just into our chest, which I believe is from a stress reaction, from chronic stress. The way our body is adapted to deal with stress is to take a deep abdominal breath, followed by expanding the chest to get as much air as possible into our lungs. The goal being to get as much oxygen up to our brain so that our brain can make the decisions very quickly that it needs to in a stressful situation to keep us alive and keep us safe. What happens when we're exposed to chronic stress over a long period of time is that we stop taking that deep breath down into the abdomen first, and we're just left with this shallow chest breathing. One of the many problems with that is that the alveoli, which you can think of as sort of the exchange centers in our lungs where they exchange oxygen for carbon dioxide, well, the majority of those alveoli are deep in our lungs, in the lower portion of our lungs. And so if we're only breathing up into the upper portion of our lungs, we're not getting as much oxygen into our body, so we're not using all those alveoli down in our lower lungs. Some other things that can happen by breathing this way is that we release too much carbon dioxide out of our blood, and this can alter the pH of our blood in a negative way, causing it to be too alkaline. And this can actually cause our blood not to move and flow as much as it should, and as well, not release the oxygen into the tissues where we need it to do the work that we need. Some other aspects of this is that this chronic expansion of this chest area causes a lot of overwork in our chest muscles, the muscles in between the ribs, our pectoral muscles, and some of the muscles in our upper back and necks that help to expand the chest cavity so that we can get some air in. Those muscles should be relaxed while we're breathing. And so this can also cause chronic stress and tension in the upper body, which can lead to trigger point syndromes, muscle pain, muscle spasm, joint dysfunction, and a whole host of other problems. In addition to that is when we also constantly breathe up into our chest, we're constantly stimulating our vagus nerve and our sympathetic nervous system. And so we start to live in a chronic stress state. By that I mean we change our whole endocrinology, how our glands operate, including our adrenal glands, and they are releasing cortisol over and over again, keeping us in this stressful state. Well, we can reverse all of that by taking the time throughout the day to check in with our breathing. As simple as that sounds, it makes a huge difference in our lives. And what I mean by that is to make sure that we're breathing abdominally, so that we're getting as much oxygen into our body as we can. We're staying in a parasympathetic state or a rebuilding, relaxing state as much as possible so that we can counteract the effects of stress on our bodies. And it's very important. It feels very, very good. And we're going to demonstrate that here. This is Amanda, my lovely assistant here, that's going to be helping me with this. If you've been breathing up into your chest, and you can look in the mirror and maybe just take a little bit of a deeper breath, and you'll see that your chest, if it rises up like that, you're breathing up into your chest, okay? If I was going to take a fairly deep breath, my chest isn't rising. And as you look at Amanda here, as she breathes, just her belly rises and her chest is staying nice and neutral and nice and relaxed, okay? So she's really just using her diaphragm to breathe. I recommend that if you're learning this, you lay down, relax, lay on your back. It's a great thing to practice at night. Great way to get yourself relaxed, get you in that rebuilding, parasympathetic state, and drift off into a nice sleep. So one of the things that you can do when you're trying to learn this is as you exhale to push in with your hands and keep pushing and pushing and pushing and pushing, push out all that air, and then just relax. And then the diaphragm will naturally pull down, your stomach will naturally expand. If you haven't been breathing this way for a long time, you might not have good flexibility in your diaphragm, and it might feel a little awkward at first. You might not get a good range of motion like Amanda has here. But check little babies and check kids. You'll see that they all breathe this way before they go to school for the most part. One other way to do this is to interlace your fingers over your stomach like this. And as we inhale, those fingers should separate. And as we exhale, those fingers should come back together. And that's another way to just kind of tune in and make sure you're doing this correctly. Okay. As you can see that Amanda's doing it perfectly. Her stomach rises as she inhales and drops as she exhales. Go ahead and practice this. Tune into how good it feels, how it makes your body feel very, very relaxed. And that's one thing we need a lot more of in our society these days. And once you get this down, laying down, practice it sitting up. Check our sitting posture video, get into that posture and practice this abdominal breathing. And what you're going to do, you're going to start to get this working more and more in your life so that when you're sitting at work or in your car, you're breathing this way, you're massaging your organs, you're keeping them mobile, keeping them functioning, getting as much oxygen into your body as you can, and also putting your body in a state of rebuilding your tissues instead of chronically tearing them down due to stress. All right, thanks again. I look forward to seeing you for the next video.